Alright, if we look at the organs that are present in the abdomen and pelvis, this is the specimen of a spleen. The first thing we do is that the convex surface is going to be present along our fingers, and the impressions of the ribs, these are the impressions of the ribs, they are going to be parallel to the fingers. And we put our thumb in the anterior border. This is the anterior border, the notched border. So this is how the spleen is present in my body. So this is how I'm going to hold it in my left hand. This is the anterior border of the spleen. This is the posterior border, and this is the inferior border of the spleen. This is the hilum of the spleen, in which different splenic arteries are entering. The branches of the splenic arteries are entering. Now, if you put a point here, this is the gastric impression. If you put a point here, this is the colic impression. And if you put a point on this part, this is the renal impression on the spleen. This, all of it, is the visceral surface of the spleen, and this is the surface that is present against the diaphragm or the diaphragmatic surface. Similarly, if we look at the spleen, we can see that this is the anterior notched border. So like this, we are going to hold it so that the impression of the ribs are along our fingers, and we put the thumb on this notched border. So this is how the spleen is present in my body. Alright, this is the diaphragmatic surface, this is the visceral surface, and this is the hilum of the spleen, in which all the splenic vessels are entering. This is going to be the gastric impression, this is going to be the colic impression, and this is going to be the renal impression. The most important things that can be asked on renal, the splenic specimen, is the impressions. Next, we have the liver. So this is the liver. As we can see that the liver is triangular. This greater part is the right lobe of the liver, and this smaller part is the left lobe of the liver. This thing that is attaching on the anterosuperior surface, this is the falciform ligament. In the inferior border of the falciform ligament, this cord-like structure is present, and this structure is the ligamentum teres. Alright, if we look at the superior surface, this part is all covered by the peritoneum, and this part is devoid of peritoneum, and this is the bare area of the liver. Again, on the left side, this is the left triangular ligament. We do not ask about the ligaments in the specimens. We ask about the impressions. So on the inferior surface of the liver, what we can see is this is the right lobe of the liver, and the right lobe on its posterior part has the impression of the kidneys. So this is the renal impression. This is the colic impression. This is the inferior vena cava, the largest lumen, which is present in a groove in the liver. This is the inferior vena cava. Right next to the inferior vena cava is the caudate lobe of the liver, and this is the caudate process, which is going towards the right side. Next to the caudate lobe, this fissure with its ligament, this is the fissure for ligamentum venosum, and this is the ligamentum. This is the start of the hepatoduodenal ligament of the lesser omentum. This is the left lobe of the liver, and all of it has the impression of the stomach. So this, all of it is going to have the impression of stomach, called the gastric impression. So anywhere here, if we mark, this is the gastric impression, this is the caudate lobe, the inferior vena cava, the renal impression, the colic impression. Alright, anteriorly, right next to the colic impression, this is the gallbladder, and the part of the gallbladder that extends out of the inferior border, this part is the fundus of the gallbladder. This is the body of the gallbladder, and then the neck of gallbladder. All of these are the porta hepatis. We do not ask about the structures of the porta hepatis in detail in OSPE. This is the quadrate lobe of the liver. Next to the quadrate lobe, this is the fissure for the ligamentum teres, and as we said earlier, this is the ligamentum teres. Alright, This is all about the liver. On the posterior aspect, this is the caudate lobe, and this is the inferior vena cava. If you look at the kidneys, this is the cross section of the kidney, and this is the whole kidney. We do not ask about the impressions on the kidney in specimens. This is the ureter that is coming out of the kidney. Rather, this is the ureter that is coming out of the kidney. Alright, in the cross section of the kidney, what we can see is this darker colored areas, triangular in shape. These are renal pyramids. This part is renal cortex, and after the renal pyramids and cortex start the renal collecting system, which consists of the minor calyces, the major calyces, and then the renal pelvis. From the renal pelvis is the start of the ureters. So this is the ureter, and these are the renal artery and vein. We can see that the renal artery has smaller lumen but thick walls, and the renal vein has larger lumen and thin walls. Alright, so these are the renal pyramids. These are the this is the cortex, and then the minor calyces, the major calyces, and then the renal pelvis. This is the model of the interior abdominal wall. In the interior of the interior abdominal wall, what we can see is this is the transversus abdominis, this is the linea alba, and the rectus sheath. This is the fascia transversalis. We cannot visualize the arcuate line in this specimen. If we look at this part, what we can see is these muscles that are directed downwards and medially. These muscles are the external oblique muscles. This is the rectus sheath that is enclosing the rectus abdominis muscle. The lateral edge of the rectus sheath has the linea semilunaris, and the medial edge where these fibers decussate is the linea alba. Alright, if we see here, this is the external oblique with its fiber running downwards, and medially this is the internal oblique with its fibers, if you can visualize, running upwards and medially. And then the innermost is the transversus abdominis.